apologies for the crude setup. My name is Steve Spurlock, and I'm here to talk to you about the NFD Community Health and Mental Partnership. Mental health illnesses are on the rise at an alarming rate. Traditional manners of assessment need to be updated, and perceptions of these patients by police and first responders need to change. Treatment of these patients need to be tailored by industry professionals, and transport needs to be directed to facilities that are appropriate at caring for patients with mental health illnesses. The CHAMP program is intended to address these current shortcomings in the care of these patients with proper triage and recognition of patients by law enforcement and first responders. We can activate providers that are specially trained to assess, treat, and transport these patients. Partnering with industry professionals, the CHAMP program can see to it that these patients receive care most appropriate for their conditions, all the while reducing the use of resources that are ultimately ineffective. When we look at the data across the U.S., mental health and mental illness and substance use disorders are involved in 1 of every 8 emergency department visits. I think that's pretty important for us to look at. This not only impacts the fire department, EMS, police department, but the hospital capacity as well. An estimated 12 million visits to hospital emergency rooms were for mental health illness. These statistics are alarming. You look down at incarceration, juvenile justice centers, 70.4% of youth in the juvenile justice system have a diagnosed mental illness. So this not only impacts what we do as professionals, but our community. When we look at it here in Tennessee and the impact that it has, 20% of adults in Tennessee experience some sort of mental illness. Nearly 4.5% of adults have a serious mental illness. And this is categorized as serious by the fact that it affects their daily lives in some way, shape, or form. And then we look at the over 350,000 people in Tennessee receive publicly funded behavioral health services. So financially, this is impactful just as much as it is to the community and to our well-being. So why CHAMP? And when we look at CHAMP, this, like I say, this program is developed for several reasons. One being a change of perception. So training is what that's going to take. And when you look at the data or the literature on this, and one quote in particular, providers shared negative beliefs about how patients with mental illness and substance abuse problems abused the system. So this was done from a study to check the perception of what EMS, how do EMS view these patients? And so when we look at that, there's definitely a need for a change in perception for mental health patients. Another study, several other studies, talk about the need for specialized training and how EMTs and paramedics feel ill prepared to handle mental health illness. There's a need for EMS to align with industry professionals. We're not trained to the level that's necessary to appropriately treat mental health illness patients. So aligning with the professionals in the industry, and for us in particular, that's Mental Health Co-op here in the Middle Tennessee area. We look at a lack of transport to appropriate facilities. And again, we talk about the ED visits and how as EMS providers, we transport, but under current regulations, we're allowed to transport to the emergency department. That's the only place for reimbursement for us. So that's what drives our care to some extent. So we have to take these patients to the emergency department, and that's not always the most beneficial or appropriate place for patients with mental health disorders and behavioral disorders to go. So we look at the logic model for the CHAMP program, and with that, primarily the the program goals, and that's to minimize the use of Metro Nashville PD and Nashville Fire Department EMS for transport of mental health and behavioral patients. Pair these patients with appropriate practitioners and treatment facilities, and that's what I was talking about. So beyond the emergency department, but going to a place that's specifically prepared to handle these patients. So the resources are listed here, and that's obviously the fire department's EMS division, mental health co-op, which I already mentioned, but we also have Vanderbilt Behavioral, and they're the only place for pediatric inpatient facility. The Community Partnership Fund, so this may be a source of revenue or initial funding for us. And then obviously the Emergency Communications Center, these calls are coming in through the 911 system, and the Metro Nashville Police Department. A good portion of the mental health calls that we receive start out as a police matter and then end up transpiring to EMS. So we need a policy that defines eligible patients. Activities would include training for not only dispatch, for PD, as well as our EMS folks here at Nashville Fire. Training for our personnel specific to mental health illness patients. Increase the availability for inpatient treatment. So Mental Health Co-op has a limited number of beds, and as I stated before, we're not even allowed to transport there under the current regulations. So having a program that allows for that is going to be imperative for the success of this program. Outputs, we want to increase the availability of mobile crisis and having them available 24/7 and utilized. Not all of these patients require transport and inpatient treatment, but they absolutely need assessment and a consult with a mental health professional, and that's what mobile crisis can do. And then, as I stated, transport to an appropriate facility. So we've got to find and break down those barriers to get us to be able to transport to these facilities that are appropriate for the patient. And so our outcomes, short term, initially we've got to change perspective. Period, the end, we've got to accept these patients as emergency medical needing patients. Midterm, increase capabilities and expertise in the initial health and behavioral treatment. So we've got to make ourselves better and better equipped to handle these type patients. And then long term, maximize the availability of care and treatment facilities. So it's not just us. We can improve our service and increase our availability to these patients. However, we've still got to have a place to take them that's appropriate for their needs. So external factors, really I think the biggest thing is potential resistance from administration of other agencies. So there's competition in everything. So if we start doing this, then somebody else is going to look and say, hey, is there a way we can make money at this? Is there a way we can better ourselves? Is there a way we can get more notoriety for treating these patients? And then poor reimbursement schedule, and that's huge. We all know that regardless of intent, we've got to have money. We've got to have funding in order to make something happen. And as it stands right now, it's very limited, and we're going to be working off grants and public-private partnerships in order to try to make this work. And then, as I stated, the limited inpatient availability. So having beds to place these patients for appropriate treatment. Those are factors that are working against us, if you will. So how does this work? How are we going to break this down? And really, it is a difficult process to try to structure this program in a way that's financially efficient, yet still effective. The goal with this, and you can see here, you know, it takes all types, right? We've got to have a program director. We've got to have someone dedicated to making this program successful. We have to work with the medical director, the current EMS medical director, because EMS is going to be working to align and transport these patients, yet we still fall under the umbrella of the Nashville Fire Department in that medical direction. So we've got to have cooperation between the medical director and the mental health professionals. Mental health co-op would be our go-to. That would be the industry professional for mental health that we would have to work with. And there's got to be a quality improvement aspect to this program. That's the only way to find out if what we're doing is successful. Are we providing appropriate care, and where can we get better? We have to evaluate what we're doing in order to find a way to better ourselves, better this program, and better provide for the patients that we seek to help. So you look under operations, we've got training, we've got staffing. You know, the training is going to be on the front end pretty heavy. It's going to take a lot to get people up to a certain acceptable level, if you will. So we know that for EMS providers, EMTs and paramedics, we have a limited education when it comes to mental health and behavioral disorders. So that's going to be big. And then staffing. This will have to be worked out with Mental Health Co-op and with NFD EMS, because this model places a paramedic along with a mental health professional that will be provided by the Mental Health Co-op to work together to assess, triage, and ultimately transport these patients to the inpatient facility. And then on the administrative side, of course, we know there's finances, there's risk management, and we've still got to have IT. I think everything nowadays runs with a great deal of technology. So all important factors for this program. So we look at the budget and where this program is kind of set aside from many others. We essentially borrow from what we have existing. Okay, and it's broken down here that essentially we'll use some personnel at about a 25% capacity. And when you start looking at the numbers, you know, that helps tremendously. We've got administrative personnel in place here at the fire department that can dedicate a certain amount of time to this program. And that would be the goal, at least in the initial phase. And hopefully this program grows, and we can find the revenue to sustain having full-time, fully committed personnel for this program. So existing positions will help offset those administrative personnel costs. And then the equipment that we purchase for this program needs to be very similar to what we have in play right now at the fire department. That's only going to make it easier for us to utilize our resources that we have in place to maintain the equipment that we get. So funding, always a big issue, right? So we got to have money. And a couple of sources for that. I mentioned the Community Partnership Fund, and that's here locally in the city that we could tap into. But on a federal level, the Substance Abuse and Mental Health Services Administration, there are grants there up to $125,000, and it's to qualify. There are several things, but we meet the minimum qualifications by being a government entity that serves the community, and then we're EMS personnel. So under their first responders, police, we meet that. Okay, so this fund, this grant is for training purposes for mental health response in the community. Another source would be the Department of Health and Human Services and their Community Mental Health Services Block Grant. But beyond that, we've got to monitor state, local, and federal services. We've got to look consistently for these opportunities, and we're going to have to reach out and find other opportunities as well. We can't solely rely on these programs to fund the CHAMP. How do we know that it's effective, right? So we get it up and going. How do we know what we're doing is right and beneficial? And I think in the early stages, we're going to have to base most of that on qualitative data. And so surveys from the police officers. Is this program easy to use? Is the referral process easy? Are they able to make calls, make an assessment of the patient, and refer them to CHAMP without a whole lot of difficulty? And I think that's going to be key. We know that that's where the majority of these calls are coming in. So we need to have the police department on board, and we need to have that process as fluid as possible. And then from the provider's perspective, you know, do they feel that they were referred to appropriate patients? And so this goes hand in hand from the start of the call and to where we get from the officers and the referral. And this may come from the communication center as well, that initial triage may say, hey, let's send that CHAMP ambulance out there, because they may have enough information on the front end, but this is going to come back to training, right? And then the patients on the backside of this program, are they receiving care that they feel is appropriate for their needs? So surveys within those three realms, I think, are going to be extremely important in the early phase of the program. As we move forward, quantitative data can then become a little more beneficial to us. So for the purpose of usage, you know, how often are these referrals coming in? Then the referral numbers versus the amount of transports. So are we using mobile health or mobile crisis for on-scene consultation? Are we transporting these patients? And if we are transporting them, are they becoming admitted patients within the facility? And this, I think, you know, back to the quality improvement portion, looking at this data, looking at the surveys, and crunching numbers and evaluating quality will give us a better direction to steer as we progress this program and help refine what makes it right and beneficial for everyone in this community. So in closing, the CHAMP program, it's addressing a need in this community. Throughout the nation, we're seeing an increase in this demographic, right? Mental health illness is increasing, and we know it, we see it. It's time now to start doing something that's beneficial for it. This program allocates appropriate resources. We found a way to fund the initial startup, and then from that point moving forward, we've got to keep an eye on what's happened nationally and within our industry of EMS, as well as the mental health industry. And we talked about funding, and we talked about reimbursement schedule, and one thing to note is the ET3 model and alternative destinations, and I think that's going to be critical to the success and the progression of this program. If we can start receiving reimbursement for transporting these patients to somewhere other than an emergency department, that's going to be huge, and it's going to be a game changer for this service, but for these patients as well, because now beyond our protocol, we have a way to get reimbursement, and it's going to make the ease and the transition into taking these patients to another facility a whole lot easier. And then again, this gives a patient the opportunity for appropriate treatment. Time and time again, we've taken these patients from pretty dire situations to an emergency department to sit and be observed for 23 hours. And then maybe they're released, maybe they have the consultation, get the treatment they need, but a lot of times they're falling through the cracks. And so this is gonna help get these patients to the appropriate facilities and ultimately reduce the number of repeat calls that we have for the same problem that's never been addressed. And then overall, increase the mental health in our community. So a lot of these patients just need their medications refilled. Maybe they aren't on their medications, you know, and then this program can expand in the future and hopefully follow up and make sure that these patients are staying on track with the treatments that they've been prescribed. So there's a huge benefit with this program, not only for the fire department, not only for the police department, but for this community. And ultimately, that's who we serve, is this community. And this demographic of patient has been kind of left to the wayside, and it's time that we change our perception, we change our practice, and we give them the ultimate care that they need. I appreciate your time. Hope you all have a great evening, and thank you again.